now in Prague, Czech Republic, and since the situation during the first wave in spring was quite well, Czech Republic was one of the countries that handled the first wave of coronavirus among like the best. And now the situation seems quite bad. So what went wrong? Can you just explain a bit about the current situation in Czech Republic?
Yes, sure, I can. I mean, now the current of the cases per day is up to 10 to 15,000. Usually there's lower number due to weekend and restricted test, and during the week we climb up to 15,000. That is a lot for the country who has around 10 million people. So we've been experiencing quite of a shock, I would say, because it went all really fast. Itself virus spreads really fast, and the infection rate just boom. Yeah, so the air number is above 1.4. So it's kind of a, bad epidemiological picture. What went wrong? I think the most that we did not introduce the measures on time, so restrictions on time, as all the countries like Italy and Spain, they had masks introduced through the whole summer period, but we did not. Yeah, we stuck wearing masks in June. And then we let a lot of also tourists inside, school started, so infection just spreaded. And things went quite a bit wrong. So now we came to the point where we are thinking about how the health system will endure this, and will it collapse? Because, the biggest concern is will have enough hospital beds. Yeah, because they're not just COVID patients, there are a lot of other patients, especially between the Czech Republic as a country who has an elder nation. So there is for certain fear, yes. We are now into the situation when the restrictions are involved. So now we implemented curfews starting from yesterday. So you unfortunately can be outside after 9 p.m. or fortunately, take it as you want. And everything is closed with bars, restaurants, only takeaway, schools are closed. We can only basically just go to work and to grab a little bit of fresh air and to the shop. Yeah, so home office is highly recommended. So this is, if I was clear enough about the situation in Czech Republic.
Yeah, you did explain it really well. Thank you.
No problem.
So tell me now a bit about the initiative that you started. So it's called Prague Integration, right? And you're doing now, especially you're focusing on the COVID situation, because we are solutions journalism website. So we are always, our focus is to find solutions to problems. And that's what I guess you're doing as well with your project. So it will be really interesting if you can tell us about the idea behind the project and how are you helping currently with it?
Yeah, we're a really small startup. We started in April. I started basically with two friends in quarantine times, where I really saw that there is a huge demand for the mental health support. Back then, in April, we started with crisis intervention with a partner company called Terapia, and now we switched to mental health support groups that is fully organized by us. Just generally speaking about Prague Integration, we are events, courses, and workshops for the foreigners in Prague, focused on easier integration by practical way of learning, yes. So we are organizing integration courses, meaning these are courses when you come new to Prague, and then you pass the 3 hours with Czech trainers and Czech people who are living here and are specialists in migration politics. So they help you to find a way how to easier get integrated into the Czech community mentality, what are some social characteristics, what to do and what to don't. So support groups, psychological and therapeutical support groups, and individual therapy sessions that are established due to COVID. And third are events and webinars that we are holding for the expats, also for kind of them to get easily informed about, now we are doing the tenants and landlords rights, employment rights, and so on. A mental health support group, as I said, started as part of the COVID situation. And there were a lot of people asking for the psychological support around, and also on Facebook groups, because they don't have, some of them, access to, unfortunately, financial access to the psychologist and psychotherapists, because here it's very expensive if you take it private. There are long lists of waiting in the public sector, and there's always a language barrier. So for the mental health support, it's kind of a harder access for the foreigners. Second of all, foreigners are in a specific group, more vulnerable because they're alone here, they're in a different culture, they're far away from their family, and the only one who can identify with them are their like expat friends. So I got an idea, why don't we conduct them all together and make the mental health support groups with our English-speaking psychologist, who is also an expat. Yeah, a little bit longer living here, of course, certified. And why don't we personally or online now, because we can't meet anymore in person, meet and, you know, support each other and talk. And it went really well. We have a lot of people reaching out to us. So every week I need to employ 1 or 2 new psychologists. It is really good. Also giving opportunity for the psychologists who are also expats and young people and really desire to help and match them with their potential, you know, clients is also, you know, one way of integrating them. So yeah, for now it's going.
That sounds really, really good. And are you hiring psychologists on like a voluntary basis, or
we are all paid based on donation for now, but we are requiring a minimum donation. We would really appreciate it because we need to have this up and running. We're in the process of getting some fundings as well. And for now, when there is mental health support in COVID times, it's based on donations, but later on we will open the market price. That will be really lower than the usual market price, 50-60% lower than now what is now in Czech Republic, because my aim is to get help for all the foreigners, so on equal level. Yes, or anyone, for example, a Czech person, yes, also is very welcome, only it's English speaking. Czech person is also really welcome if person doesn't have access to health services or unfortunately can't afford it. So we are also planning to do it for them and eventually employ the Czech speaking psychologists. Yeah.
And did you see similar initiatives maybe elsewhere, or are you thinking after you like work on this longer, maybe to launch in other countries as well, maybe in like neighborhood countries? Or
that is in a plan. I mean, my plan is a platform, online support, mental health support group platform where people will match from, first of all, for example, neighboring countries, then from Europe, then from world with the psychologists, and we work on a minimum donation basis. So, or a minimum membership. I need to really think about that. I think because I will also, I see the potential, how is growing, how is needed here. Probably it's also needed, not probably, for sure is needed in the other countries. So this is kind of my long-term plan.
Yeah, I was just thinking about it because I didn't really see similar initiative, for example, here in London, and I think it will also be very needed. So I think it's something that potentially has a really good sort of basis to become more global maybe, and for you to kind of expand to other areas as well.
I would be happy to do it.
Yeah. And how are your experiences so far with it? Could you maybe give me some example of someone who you're helping at the moment, or?
I can give you an example of the, expat, profile of the expat. So expat is a person who is foreigner in Prague, lives here for minimum number, for example, 3 months to 2-3 years. Is coming from another country. Usually it's from EU and non-EU, so we have both of them. Yes. And is experiencing a certain problem connected with isolation, so loneliness, anxiety, uncertainty about the current situation, fear about the government measures, fear what is going to happen to them in the foreign country if they don't speak the language. And besides that, some regular problems that we are all experiencing individually in our 20s, 30s. Even we have people in 40s, they're not permitted, but usually this is the profile of the expat, someone who is in 20s, 30s, relationship problems, finance problems, adaptation problems, finding your place under the sun, just finding your identity and so on. So that always also comes out on our sessions. So this is kind of let's say, profile of the expat who is coming. For now, we did off last week, and we have quite a lot of clients. All the groups are full. Every day we are full. So we are, again, trying to find a place for more meetings with more psychologists. And we are introducing from November, I think middle of November, for LGBTQ support group, and for the parents, we are also introducing the support group. So this is also something new that's going.
Yeah, that sounds really, really interesting, and I wish you good luck with it. I'm sure that it will help many people, and I think it will be amazing if it also expands more globally to some other countries as well. I think it's such a good idea.
I'll also like that.
Yeah.